In this video, here's what we'll cover. Why adult ADHD gets missed. What adult ADHD looks like. What a proper assessment involves. The grief that comes with diagnosis. What actually helps. Let me tell you about someone I'll call Priya. She's 38, with a good job, 2 kids, and a private worry she has carried for years. That she pours far more effort into simply looking organized than everyone around her seems to. She starts things full of enthusiasm and rarely finishes them. When her own child was assessed for ADHD, the description held up a mirror, and the face looking back was hers. Not long after, a friend mentioned she'd been diagnosed with ADHD in her 40s, and called it being handed the manual to a machine she'd been operating without one for decades. Priya laughed, then she stopped laughing, because it landed. If any of this sounds familiar, you're not lazy, and you're not alone. Adult ADHD is one of the most under-recognized presentations in Australian mental health. The International Consensus Statement on ADHD, endorsed by more than 80 international experts, is clear that adult ADHD is a valid, treatable neurodevelopmental condition. Prevalence in adults sits at around 2.5 to 4%, and a large share of those adults were never identified as children. In my practice in Bella Vista, the person I most often see is a professional in their 30s or 40s, often a woman, and often the parent of a recently diagnosed child, who has quietly managed for decades and finally run out of workarounds. So what does adult ADHD actually look like? It's not simply having a busy mind. It's a persistent pattern of executive function difficulties that gets in the way of work, relationships, and daily life. The first is attention regulation, difficulty holding focus on tasks you find dull, and sometimes locking on so hard to interesting ones that everything else disappears. The second is working memory, losing the second half of a sentence, or forgetting why you walked into the room. The third is time blindness, badly misjudging how long things take, so you're either very early or very late. And the fourth is emotional intensity, feelings that arrive fast and take a long while to settle, alongside a strong reaction to any hint of criticism. None of these on their own means ADHD. Everyone forgets a birthday. But when the pattern is lifelong, and it's causing real trouble across several parts of life, it deserves a proper look. And that proper look is an assessment, not a 15-minute checklist. It takes time, because the diagnosis carries real weight, and because so many other things can look like ADHD. It starts with a detailed clinical interview, covering your current symptoms and how they affect work, relationships, and daily life. It moves into a developmental history, school reports, childhood patterns, and any family history of ADHD or learning differences. It draws on validated questionnaires, chiefly the ASRS, developed with the WHO, and the CAARS. And where possible it adds collateral information from a partner or parent, along with screening for anxiety, depression, trauma, sleep, and other conditions that overlap. The result is a formulation, not just a tick in a box. Some people I assess don't meet the criteria for ADHD at all, and the assessment instead points to something else that's treatable in its own right. People often expect a diagnosis to feel like pure relief. Usually it's more layered than that. There is relief, a name, at last, for something long felt but never explained. But there's often grief too. Grief for years of trying harder and blaming yourself. Grief for the job you left, the course you never finished, the mornings you couldn't face. In the room, I treat that grief as important. Left unnamed, it can harden into a quiet anger that chews through the energy treatment needs. Making room for it early, often within an ACT frame of values and self-compassion, is one of the most useful first moves. Cultural context matters here as well. In many families, a child who couldn't sit still was called naughty, and a child who couldn't focus was called lazy. Naming that history, without blame, is part of the work. So what actually helps? Modern evidence supports multimodal treatment, combining a few approaches rather than leaning on any one. The first is medication. For many adults, medication prescribed by a psychiatrist or pediatrician can lift the baseline from which therapy, systems, and sleep all become easier to build. That decision belongs with a prescribing doctor, not a psychologist. The second is psychological therapy adapted specifically for ADHD. The strongest evidence supports CBT tailored to adult ADHD, targeting procrastination, time management, and the harsh self-talk that builds up. ACT helps with the shame and rigidity. DBT skills add practical tools for emotional intensity and rejection sensitivity, and EMDR can help where trauma is woven in. The third is environmental and lifestyle scaffolding. Sleep, movement, and structure are core treatment, not optional extras. One large review found regular exercise produces meaningful improvements in anxiety and low mood, both common with ADHD. A typical treatment journey I offer runs across roughly 8 to 15 sessions, longer when trauma or other conditions are present. Progress is rarely a straight line, so I say that at the start. It never feels like failure that way. If any of this sounds like you, or like someone you love, please know these patterns are common, understandable, and very treatable. You can read the full guide, or book an appointment at our Bella Vista practice, Potentialz Unlimited, using the links in the description below. And if things ever feel unsafe, please reach out to Lifeline or 000 straight away. Asking for help isn't weakness, it's one of the most practical things a person can do. Before you go, here's a quick recap of what we covered. Why adult ADHD gets missed. What adult ADHD looks like. What a proper assessment involves. The grief that comes with diagnosis. What actually helps. And one small thing that really helps more people find this. Subscribe for weekly mental health explainers. Like this video if you found it helpful. Share it with someone who might need it.